Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. Today I'm going to go through a scar patient. This is an acne scar patient that we worked on over the last year. You can see for this particular patient, she has mostly Boxcar scars, some rolling scars, and we had to do a few different things to be able to get to this at this point. This is a little more than a year out now over here for this patient. So Asian patient, this is a patient of Korean origin, and we're slowly chipping away at her scars. We're going to continue to get better and better over probably the next 6 months or so. When she came in this session, when she came in for this photo, actually she came in yesterday, we ended up doing some TCA Cross and some Bellafill for her, which worked out really well too. So she'll get even better and better results. You can see when you're looking at this, this is a nice realistic expectation for a patient with these kind of boxcar scars, ice pick scars, what we could try to achieve. Actually, I'll try to make it a little bit bigger for you guys so you could see a little bit of what we were working with and give you a sense of kind of what you could potentially expect. And I like to always, showcase this for everybody, just that this is a nice realistic result of a progress report. We're not done with this patient. We're in the middle of the process here, but we will continue to get better and better results. If you notice for this patient, she had a lot of hyperpigmentation. So even though she's somebody with that hyperpigmentation, we were able to clear up that pigmentation and, still used a blade of CO2 laser on her and some edges of those scars. And we didn't run into new pigmentation issues, which is really nice. The pigmentation on her skin lightened, yeah, absolutely it did. And so it's like, yeah, really fun to see that, right? Like it's like you could see for patients that we don't have to actually, worry about pigmentation if we do this properly, safely. Sometimes we have to go slowly, and we may not be able to just rush it like we can for some lighter skin types, but ultimately we can still get to that same progress, that same point. It's just a matter of sometimes just a little bit more work and just taking it a little bit slower. Brody's asking, I was curious, does Accutane get rid of acne scars? Well, it may help a little bit with some of the superficial ones. So superficial scars just could stimulate a little bit of collagen production there. And sometimes it could shrink the pores as well, shrink some of the scars, the diameter of the scars. So it could help a little bit with that. But it's not going to help enough for like these kind of thick scars, not going to help enough for those. So, it's for some portion of scars, it may help, like the ones that are the ice pick scars where you're a little bit wider because of oil production. But it's not going to help enough really for a lot of people. What about Tretinoin will help with these? It'll help a little bit. It's, again, not going to help enough, though, for these kind of scars, though. So that's, again, the other challenge there. Thank you, guys. Thanks so much for coming on. Thanks for all the kind remarks. Appreciate everybody that always says those things. People are just commenting about the process over here. This is not a final result. This patient's very realistic and aware that it's going to take another several months really for us to continue to get improvement. But it's I want to show over and over and over again the realistic ways of improving scars. And it's important for everybody just to sort of have the expectation and just what to see, when you see these type of things, that it's not about like that first week. It's not about like the micro swelling that you have. This is 1 year and some change later where we got this improvement. What do we do? So this was basically a few sessions. Essentially, the first session we did subcision, we did TCA Cross, we did a blade of CO2 laser at the edges of the scar. I did an erbium laser as well at that point, and I placed a little bit of Bellafill in the temple area, and then we subsequently did a few more rounds of TCA Cross, and then about 3 months ago, I did another round of laser actually for her. So it was a few different sessions actually to get to this point here. So let's, slow process. She has hyperpigmentation. I have to be really careful still. So when I was doing this, I was focused where the heat was going to be, was just really going to be for the thick elements, those thick scars. And otherwise, I didn't really go into the areas where, there's not much scar tissue. I didn't want to use excess heat for those areas there. So this price point, people are asking for prices. The price, most patients spend about $5,000 to $7,000. This patient, she does have a lot of volume loss. Actually, it's not as visible in this photo, but she is in her late 30s, and just from aging, there's some volume loss as well. And so we had to place some Bellafill in this patient, so it does get a little bit more pricey at that point. But that could end up getting closer to about $10,000 or so for some patients there. Do you accept a Blue Cross Blue Shield? They're asking. Well, it's insurance doesn't cover scars. That's the bottom line. That's the reality is that insurance companies just don't cover it. I wish they would, but they don't cover it. So if you feel like they should, you should probably try to ask them why they do not cover these scars. Should people do Bellafill first and then lasers? It's a good question. I mean, you could do something to lift up the scars. I guess that's what you're asking. If you try to make it so that it's raised, I'd prefer to mostly do more like subcision, break it up, pop it up a bit there. It's just sort of my preference because what I'm trying to do a lot of times is with the way I do it is I'm softening up the edges of the scar. And when I'm doing that, I essentially just want to make sure that I'm just getting really nice to the base of the scar as much as I could. And like there's these thick elements there. Sometimes there's with Bellafill, it's like for the first few months or so, it's a little bit swollen. So maybe a little bit off on how much of that is real scar tissue, how much of that is just going to go down with the Bellafill. But if it's like, you're giving it maybe a year or so afterwards, then sure, it's okay. It just all varies on what we're looking at and how thick those scar edges are. But a lot of times I would prefer probably just to break up the scar tissue and then pop it up. And then if we have some localized spots that we can do Bellafill, sure, absolutely. But then I'll have you come back a month or so afterwards, and then I'll do the Bellafill then at that point there. So I stage a lot of those things for volume. Volume goes a lot longer, slower than, I would say, people expect. There's a lot that's involved with it, especially a patient like this. She's of Korean origin. She has very high cheekbones. She doesn't want to make her cheekbones more wide or anything like that, but then her scarring is also in the lateral cheeks. So I have to be able to put it in small pockets there and be really precise and just wait a little bit and then put a little bit more in some pockets there. And just really want it to blend in and look really, really nice over time. So it's a slower process than people may expect. That filler, that process, really, it's way, way slower than people may think because I just can't make it look too stiff and too natural. When were these pictures? I'm not sure what you're asking here. Will these pictures stay in place? Yeah, the results will stay in place, really. The things that really do shift are like your own natural fat pads. You could lose some of that, and then you could start seeing a little bit of scarring from that. It's not going to affect this patient too much more with that, though. The texture, though, she gets to keep. That's hers. That doesn't change. So as long as she's also good with sun exposure, heat exposure, and making sure that she doesn't have new acne, things like that, new lesions, she gets to keep this, which is awesome. Is there any one case you're most proud of? If so, tell us about it. Yeah, I've been showing a lot of that over the last few weeks. And I mean, I would say there's like a few that I'm really, really proud of and happy with. I get really happy with, especially the ones I've seen from like years ago, to be honest with you, because I want to see people like over years and like see how it is. Like, yes, I know that like it looks really good a year from now, but then like my own face, for example, it looked better, a year and a half later or so. And sometimes it like takes 2 years really for that collagen production. And so it's like, it could take a little bit more time than we expect. And so it's nice to see that over time and you can see, okay, it's awesome that 2 years, 3 years, 4 years, 5 years, it looks really, really good. That's a really, really good feeling. So that that to me is really a lot more rewarding. Just like seeing that when patients like over time, like there's no question at all that this worked really well for people. Eric is saying, hi, I am prone to keloid scarring. I would like to go to you for my first session from another clinic. Almost every injection site led to keloid scarring. I'm sorry to hear about that, Eric. There's definitely ways of preventing keloids. We want to prevent friction after we do these procedures. And a lot of my patients, I do recommend, especially like for this patient, for example, what we've been doing for her is we use silicone tape there afterwards. And that actually helps prevent friction on the areas that we just smoothed down. And then also it'll actually help hopefully prevent also a keloid formation too. So silicone tape is really one of the things that I do to help with that. There's a lot of tricks actually. And also what we do is when we're doing subcision, we put a lot of tumescent, a lot of numbing solution in there so we could glide in there really nicely. How many sessions is needed for this? Well, it's depends on how thick your scars are, depends on how much pigmentation you have, how much laser we could do for you. Those are things that kind of factor into this. What kind of scars you have? If it's just really just volume loss, or like just really a matter of rolling scars, deep scars with pockets of fat that are lost, then we would want to actually break up that scar tissue and put a little bit of volume in there. And that's a little bit faster, actually. You can see that improvement a little bit later. Melly Elephant is saying, will it be helpful to use silicone tape while on Accutane to help prevent scarring? Well, it's more for like these thick edges of the scar, so that's what it's useful for. But if you're breaking out while on Accutane, you may want to double check to see if you should be on some sort of antibiotic, like a topical antibiotic potentially, for the bacteria component, because Accutane is working on the oil, but you may still have some residual bacteria there, and you may need to be on something for that. So just double check to see, whoever prescribed the Accutane, to see if you should be on something topically to help with that. And then, on top of it, if you have inflammation, then yes, you could do something like silicone tape that'll help that inflammation and prevent that scarring from that point. What are the best products to fade post-inflammatory hyperpigmentation? Well, there's over-the-counter products, which you do like 10% azelaic acid is easy. You could also do Eucerin's anti-pigment cream. That's a nice, easy product. You could use different cream. It depends on are they discrete spots, or are they just kind of diffusely, pigmented. And there's sometimes, if you've tried those things and it's not working out, then come to someone like me, and I'll help you with a pico laser and potentially other peels, things like that that we could do in our office. But there's, definitely a lot of options for pigmentation. I do a lot with that. How much is consultation? Consultations are $150, and you can do it directly on our page. Just go to drqazi.com and schedule it that way, and then my team will schedule it out. I know a lot of people were asking, my team and everything like that, about when next availability is. It's really probably mid-April or so. I try to see as many patients as I possibly can during the day. I have a lot of procedures and a lot of consults and follow-ups that we do. The earliest time that I could potentially see people is going to be April. And then you can always request to be on the cancellation list or something like that to be able to see me earlier. CL, how's it going, CL? CL is saying, I went to you for Bellafill on Thursday and you mentioned I have malar edema. How can I fix that? Well, there's a few things you could do for malar edema. You could do sometimes radiofrequency microneedling to tighten the skin over there. Sometimes you may need to do a little bit of subcision actually over there as well. And the Bellafill actually could help as well if we put the Bellafill in those pockets there. So let's talk a little bit and we can see what the best options are. Aang is saying, how do you treat really small, deep ice pick scars? Sometimes it's excision, just actually taking out that scar. If it's the right spot, you can actually just excise it and take it out. Sometimes it's just more TCA Cross. Gloria, how's it going, Gloria? Gloria is saying, 5 to 6 months after stopping Accutane and having great results, I've been getting acne again. What should I do? You really should do some sort of topical retinoid. So the Accutane is the vitamin A, and you should be on something with vitamin A. So, consider doing something like adapalene, which is over the counter, but really probably better to start with Tretinoin if you're able to get that prescription. So Tretinoin is a great option, like start 0.025 and then slowly incrementally go up on that every few months or so. And notice I said a few months because I go pretty slow with it. I don't think that you have to rush it as fast as people do because it just overly dries the skin there. Which laser would you recommend for brown skin that has to help ice pick and boxcar scars? Well, those particular issues, you may not do the laser necessarily. It may just be like TCA Cross, potentially a little bit of subcision and some Bellafill there. But if we need to do a laser, it's for like the thicker parts of the scar, and that usually is more like an erbium laser or a CO2 laser there. Does BioRepeal help with hyperpigmentation and scarring? Not so much with scarring, but it would help a little bit more with the hyperpigmentation part of it. Yes, it could help with that. Can deep acne scars, fillers, and or past subcision affect a facelift? I guess it depends on what kind of filler they're placing, where they're placing it, like the depth of it, and what kind of scars you have, the location of the scars, a lot of different factors in there, what products they're using for filler. My partner is a plastic surgeon. She's done facelifts on patients I've done all those different things on. She has no problems with my patients. It's very easy. She said it just feels and looks just like real skin. And in fact, the scars look better after the facelift. So it works out really. But there's other practitioners that may do a lot of filler, like too superficial. And then, yeah, you may run into problems then with that. If it's like the wrong product, it's too thick, things like that can end up happening. And so we have to, kind of be careful about who you're going to and double check to see what kind of products and materials they're putting in your face. My patient today, she was somebody who flew in from Vegas. She wanted me to do ultrasound guided dissolving for all of her filler. And she said that, they were just guessing where the filler was. And she had so much Juvederm all over her face, just like balls and balls of Juvederm. And it was just placed so superficial. Like just, it's really sad because for her, it was like she was looking at her face and it just wasn't looking like herself. She had done fillers in order to look better. She was hoping to try to improve her smile lines. And then someone was just like upselling her to do a bunch more, fillers and do all this stuff. And they just kept on telling her to do more and more. She was like, it looks a little puffy. And then they were trying to balance it by putting a bunch more elsewhere. And she just like drew in too much water. It just looked like it was really, really puffy and just not herself. So hyaluronic acid filler could be, you could run into problems with things like that. And then, yes, if you do something like facelifts potentially, and there's some swelling over there and there's product over there, you really should dissolve that before you do those procedures too. Eric is gone is saying, do you accept people who are on low dose Accutane, or should I stop before I visit your clinic office? Yes, I do. I do several patients on Accutane, but I just have to make sure that the oil is better controlled, acne is under control. That's the thing I'm really looking at. But yes, we could do these procedures while on there. Juliano saying, when you stretch my skin, 80% of my scars disappear. What does that mean? What treatment is best? It's tough to say, but a lot of times there is some aspect where it's tethered and stuck. Sometimes it's just relatively superficial. We just want to superficially break that up. And sometimes it's just little pockets of just a little bit of volume loss. So you may just need to put a little bit of a product like Bellafill or Sculptra to support that area. But, if it's really just a matter of just a little bit of laxity and just pulling it back there, sometimes what you're seeing is the fat shift into that pocket of scarring. So basically think of it like there's a fat pad here. You're pulling it back, you're pulling that fat pad back up into that. And now sometimes you could see actually that there is less scarring. So that there's probably a little bit of volume loss over there. So that's probably what you're ending up seeing right there. And if there is that volume loss, you likely need to do something for volume, like a fat transfer, Bellafill, Sculptra, something like that. Is microneedling helpful for scars like in the picture? I got to double check about this patient. If she did microneedling, I can't remember offhand. But if, a vast majority of patients who say that they've done microneedling tell me that it did not work for these kind of scars. Very, very mild, if at all effective. Like, the skin overall looks better, but it's not like, doing much for the skin. Would you do punch excision or subcision? Well, sometimes both. Yeah, we could definitely do those. It just depends on what kind of scars. If they're deep ice pick scars, wide Boxcar scars, and deep Boxcar scars, then excision is sometimes the best option. It depends on really what kind of scar it is. So I guess I have to get an understanding of what it is actually. Can you show acne scar before and after of someone with South Asian skin? Well, yeah, I did last week. I did a couple people there like that. I'll try to put that on the list of people I should do. If I could find something on my computer, that'd be great. But I don't have any just offhand right now. I'll see if during this week or next week I could do it. Let's see here. I know I missed a bunch of questions, so thanks for bearing with me here. Let's see, where was I at? Can subcision followed by endolift help with ironing out scars? Good question. The endolift, which is basically going to be internal heating, can help a little bit with breaking up some more of that fibrotic tissue. It can help a little bit with those fibrous bands. But there is an element that I'm a little bit concerned about with endolift, which is that sometimes it could actually potentially melt fat. So I'd be a little bit worried about that melting fat, especially when you're talking about scars. Not a good idea, because then you could end up having that big indentation over there from fat loss. And, the other thing I get sometimes a little bit concerned with people who do endolift is that I don't see them actually when they're doing, the endolift in the neck, for example. I don't really see them doing afterwards like liposuction or anything like that. So I'm not entirely sure how it's marketed to certain people that don't do liposuction. But it is something important that what happens if you are melting some of that fat. I know sometimes they'll say, well, it's in this layer where it's not going to melt that, but I don't know, because there's enough heat over there that it really could melt that. And I think that there's a lot of questions sometimes with these things, especially energy devices inside the skin. How old am I? I'm 42 years old. I do a lot with these procedures too, these lasers and energy devices, and a lot with collagen stimulating products. What's treatment for boxcar scars? So boxcar scars depends on the depth of the scars, depends on your skin type. But sometimes what we need to do is just go underneath there, break up that boxcar scar. It pops up pretty well sometimes, place a little bit of Bellafill in there. But other times you may have to soften up the edges more with lasers. Would Morpheus 8 help the remaining scars on the right picture? No, it won't actually. It won't. In fact, it actually may make it worse because you could end up using too much heat and it could end up causing some fat loss. And that's one of the things I'm talking about over here. I really want to avoid procedures that could cause fat loss. It's really important, especially when we're talking about scars. I mean, in general, you need a lot of your fat on your face. But if you're doing something for scar purposes, the last thing you want to do is destroy some of that fat, because that's like, it could end up a big problem. And you end up actually then seeing more of that scarring. Alex is saying, doctor, for extreme acne scars, volume loss, is it okay to use like 10 to 15 syringes of Bellafill per session? I would never do that. I just would never do it that way. It's way too much in my mind. One of my patients today, she said that she was told by somebody that, told her to do 8 vials of Bellafill right then and there. And she does have a lot of volume loss, but he didn't even tell her to do a bunch of subcision. Everything was stuck and tethered. And so it's like when you do something like filler, any Bellafill, anything like that, it's going to go around the scars. It's going to go around the tethered bonds area. And it could end up looking, a lot worse because it gets swollen around the scars. So the areas around the scars look puffy and you still have a big indentation over there. So it's unfortunate, again, that people kind of push that stuff. I have a lot of people that would say that, they were told that they had to do this many vials of filler, otherwise they won't see improvement or results. A lot of times I'm doing just 1 or 2, like that's it, and then at a time, and then I just like slowly build on it, slowly build on it. As Joey's saying, and over here he's saying slow and steady is the way. Absolutely, it's slow and steady. You're rushing things, you run into problems, and so it's like about precision, being efficient. I agree with all those things, but you never want to actually make it so that you're putting a bunch of product in areas that don't need it. I don't even know what you would do with 10 to 15 vials of Bellafill, and even like people with enormous amount of volume loss, I just can't ever imagine putting that much in at a single time. Slow. That's what the whole point of this is. So everybody that kind of looks at this and says, this is 1 year out. This is what it is. This is sometimes for patients that they go through that, and maybe you'll appreciate a lot of people that go through all this now a little bit more. You can see like, okay, it at work or anyone else. I don't know. I'm not sure if everybody on here is suffering from scars or anything like that, but maybe people that are, and you can know that this is what people go through. They go through a long journey. They go through an emotional roller coaster for the stuff, and it's really, it's something that you have to be prepared for. But it's really rewarding at the end. This patient's really happy at this point, and it's going to get better and better. Let's see here. Madeline is saying, what area are you in? Is fat transfer an option compared to the filler option after scar treatment at your location? Yes, we absolutely could do fat transfer, but just may not be the best option though. Certain kinds of scars, certain locations of scars, you may not want to do fat transfer. So it's absolutely possible. My partner does fat transfers all the time, but it's, it varies. It depends on if I think that it's going to be enough of a result. I also want to make sure that for that particular kind of scar, it's going to be able to lift it and improve it enough before we do it. But of course we could do it. If we need to do it, we could do it. It's just the things I do. It's just it's going to be the best option for you. But like, it's not like, some people say, well, should we just do fat transfer for one scar? And it's like, it's going to be too superficial of a spot there. It doesn't make sense to do an invasive procedure and put some fat over there. And we don't actually know if that fat in that little pocket right there is going to last well enough to be able to have enough result. It's just, that's something I would prefer. Juliano is saying, here in Canada, nobody does fat transfer. My doctor told me that they don't do it because things can go wrong. Is the fat transfer you do 100% safe? Well, nothing's 100% safe. Like nothing is 100% safe. There's absolutely no way anything you do is 100% safe. And anybody who says it's 100% safe just doesn't know what they're doing. And it just, it's actually honestly risky because it's like, you're doing this literally risky. And like, I don't know what you're doing. You should really be aware of all the potential complications. I think, like in my mind, I always think worst case scenario, like everything in my life, I think worst case scenario, then I work my way down, like literally with everything. So I start like that, like the worst, like what's the worst that could possibly happen if I do this? And then I'm like, okay, then let's work my way down. because it's like, that's just how I think. I just like always think worst case scenario. What's the worst thing that could possibly happen if I did something like this? So it's like, if I'm saying it's like this, I've already gone through that algorithm in my mind and know that this is like, that this, in this particular case, the the benefits actually outweigh the risks. And we'll talk about like the potential risk. But yes, in our hands, there's extremely low likelihood. And in fact, actually for fat or Bellafill, subcision, all these things, lasers, you can see we do even in darker skin types. It's a South Korean patient with pigmentation before. Afterwards, her pigmentation's gone. And somebody would say, you can't even do this on this patient. We did it. And so was there a risk of doing it? Yes, but we could do it properly. I do it at a very, very high level. So it's like, she was aware that it potentially could get worse, but she also trusted me. She trusted that I'm going to be really careful, meticulous as I do it. And I did it, and I do it. And I am always going to do that. That's the thing. I'm always going to be very, very careful, meticulous when I do this. So if I have a patient in front of me, it's like, just like proper, it's done. And like, I just know that it's going to be like, I just have to do it at an exceptional level. I grew up with like Michael Jordan. So it's like, he went to go practice at like 4:30 in the morning, 5 o'clock in the morning, even when he was at the top of his game. He just needed to make sure that he was like always really, really excellent, no matter what was going on. Even if he was like winning the MVP, he like made sure he was like at practice and was like killing it. And he was like there before everybody else. And I love that. And that's what I grew up with. Like I watched that and I saw that. I watched his games and I saw like just how hard that guy worked, and like it was ingrained in me, and it stuck with me for the rest of my life. And I kind of feel sorry for this younger generation who just doesn't know like that, like Jordan, like as much as like the flaws he has and like the competitive nature he has, all that stuff. I agree, but like he when he was there, he did it. He put his energy in. Nobody could say you didn't put your like 100% effort in, and that's like exactly what I want in life. I want it every single time I'm doing something. Nobody could say you didn't put your 100% effort in it. What is the name of the procedure again that you're talking about? Well, there's a few different things. This is with subcision. This is with TCA Cross. So basically subcision is where I go inside the scar and actually break up the scar tissue, manually lift up the scars. TCA Cross is where basically I use a paintbrush. I like a paintbrush because I used to paint a lot. So I go inside each of those little scars, and I use a little bit of acid there. And then I used a laser to soften up the edges of the scar. So I did a few different things, and then I put a bit more with collagen stimulating products over there as well. Recommendations for hypopigmentation and scarring. There may not be too many great options for that. There may not, but it depends on the depth of the scar. Something you could try initially is something like tacrolimus potentially, but it may not be the best options though, to be honest with you. How many times can you do subcision? I mean, once or twice, really. Like, I don't know why you would do more and more of that for that invasive procedure. If you're doing more than that, really talk to someone like me, because it's like something else needs to be done. Really, I'm not sure what's happening there. How high is the risk of damaging facial nerves by subcision, and how do you avoid it? Well, we're really actually in a superficial layer really there. I'm actually in something called the intradermal layer. I don't go subdermal like a lot of people may say, well, go subdermal. I don't believe in going subdermal. I go mostly really intradermal, where risk is very, very low. So if there is a small little, peripheral branches of some nerves, there's other ones that will just actually go in there if you really need to, if it does end up getting dinged. But very, very low likelihood. I haven't had anybody with long-term facial nerve issues. So, it hasn't ever happened to me. And I do so much subcision. Most of my work though is with blunt canal subcision. And then for some pockets, I'll do something like a Noco needle or talar liver subcision. So the way I avoid it is really by being very precise. Hi, Alchemy, how's it going? Good seeing you again. I think you're coming tomorrow, you said. Hopefully we'll see you coming tomorrow. Alchemy asking, hi doctor, what treatment was used here? So we did basically TCA Cross, we did subcision, and then we did a little bit of Bellafill at some point in the temples, also a little bit of Bellafill in the cheeks, and we did CO2 laser and erbium laser for this patient. So a few different things, and then we've seen her a few times more for some erbium laser. How effective do you find TCA Cross, and how many treatments are needed to see great results? Depends on how deep the scars are, what your ethnicity is, what your sun exposure is. how much oil production you have. All those things could factor in there. It could take anywhere from 4 to 10 sessions sometimes. It depends. It's really hard to predict. There's some people that really just like 2, 3, 4 sessions could be great. Some people need, this patient, she's been doing 4 sessions here, and some people can need 8 sessions. It just depends. And if we could use a laser to cut down a bit, it'll be a lot easier then. Hi, Ellen. How's it going? Hopefully you're doing well. We always appreciate you coming on as well. I know it's late for you tonight. Applejacks is asking, what are your thoughts on do-it-yourself TCA Cross at home? So TCA Cross is not particularly expensive for us. You could take a look at our page. And I myself, I do probably the most TCA Cross in the world. I mean, I'm not even just exaggerating. I don't know if there's anybody out there who does more TCA Cross than me. And I wouldn't do it on my own face. So just think about that. I wouldn't do TCA Cross on my own face, and I do the most in the world. So, I wouldn't even do a lower concentration on my own face. And the reason why is I've seen so many people with scar widening, burns, things like that from TCA Cross, and they've done it with professionals, and some of them have done it at home. It is something that's really risky if you're just doing it improperly. And again, I do the most in the world, and I wouldn't do it on my own face. And I have a super steady hand. It's super steady. So, I don't know how well your hand is. I don't know if your hand's gonna be more steady than mine or anything like that, and you've done more TCA Cross than me, but I 100% would not recommend it, because if I'm not doing it on my own face, I'm not sure why you would do it on your face, with TCA. Unique is saying, if my scars look like the scars on the right, what is the price range for healing? It's tough to say. It's probably going to be less than what I was saying. That most patients spend about $5,000 to $7,000. If you're already kind of at that point where it's at the right hand side, it may end up being $3,000 to $5,000 or so. It depends on I don't want to misspeak or anything like that, depending on what you're looking at, but how much volume loss and things like that. But it could just end up being $3,000 to $5,000 or so. DD's asking, hi, Dr. Qazi, what are your thoughts on microneedling, especially on darker skin to fade dark marks? I don't think it's going to help much for dark marks. In fact, it could sometimes cause more dark marks. And my patient today, she ended up doing it for her ice pick scars, and it caused boxcar scars. And I've been mentioning that many, many times. So she has wider boxcar scars because she was doing microneedling some of those spots. She's like, for sure, this never happened like that. It wasn't like this before. And then they did microneedling, and now they're wider. So tough, it's a tough thing, but I know that people want to jump to microneedling, say just do microneedling. Not the best thing for a lot of these scars, really. Make a little bit of collagen stimulation, but not enough for that. Yes, Joey, it is a satire show. We'll have to remind everybody every night. How would you categorize the severity of these acne scars? So this is moderate. These scars are moderate. She does have some volume loss over here. It's some areas I would say even moderate to severe, like in the cheek, temple area, more moderate there. It's because of the density. There's some volume loss over there. It's not as noticeable on this particular static image, but when she smiles, there's a lot of volume loss around the scars too, as well. So there is fat destruction as well. And then the other things that makes it a little bit more complex is the fact that she has some hyperpigmentation as well. What's my opinion on Skin Vive? For scars, it's going to be very short-lived. One of my patients today, she told me it just only lasted about 3 months for her. So I'm not sure if it's really going to end up being something that's going to be too helpful for long-term for patients. As a quick fix, maybe. Why does volume loss happen with acne scars? It's a long topic. I'll talk about that tomorrow because I'm going to be done on time tonight. I'll just finish this last one here. It's Piso Gummy saying, I talked to you about Tretinoin 3 months ago, and it completely reduced my deep-looking scars. Awesome. I'm really happy I was able to help you. And thank you so much, Asmani. Thank you so much for everybody that popped on. I'm going to be done on time tonight, so I will see you again tomorrow at 9. And for those who are asking those questions that were kind of just, I said I'll talk to you about tomorrow. I'll hit you tomorrow. Just come on time at 9 o'clock, and we'll start with those questions there. This was a little more than a year later for this particular result, by the way. And thank you, everyone. And this is people asking the ethnicity of the patient. She's South Korean origin. Appreciate everybody. Take care.